It's exciting. We've got a lot of people joining. It's going to be a good conversation.
Yeah, fantastic. So we'll just give folks one more minute and get rolling. But while we're waiting, why don't I introduce you and give everyone a sense of your background? So Dr. Renae Thomas is a Lifeforce physician. She's a medical doctor. She also has a Master's of Public Health, and she's triple board certified, including being one of only a handful of doctors in the US who is certified in lifestyle medicine specifically as a discipline. So fantastic expertise, fantastic person to have on the team. We're really grateful to have Dr. Renae working with us at Lifeforce. One thing I think was interesting about your background, Dr. Renae, that you could share a little bit more about is during your education, your training, you actually spent time in Loma Linda, which is a blue zone. And for folks who aren't familiar with blue zones, these are a handful of places around the world where people live an unusually long time, often well into their hundreds. So why don't you just share a little bit about, what led you to want to go and conduct research in Loma Linda, and what were some of the key takeaways you took away from that now inform your own practice around
Yeah,
longevity and health
absolutely.
optimization?
And really, to keep a long story short, my journey into medicine began with actually my dad having metastatic cancer before his 40th birthday. So very young, end stage cancer. And you can imagine being told that diagnosis before you're even 40. You're going to do everything you absolutely can to not make that your reality. And in all of his kind of research and looking into what he could do, he came across the Adventist health studies. And that really drove, for people not familiar with those studies, they really look at nutrition and cancer specifically. That really drove a lot of the way I was brought up and the way that my dad is now still nearly 70. He did not have the terminal diagnosis that he was given from changing a lot of his lifestyle and amongst other medical procedures and things like that. So I was always very interested in the Adventist health studies, and they are from Loma Linda. And so there's two major things I would say Loma Linda is famous for. It would be being a blue zone and the only one in the United States and only one of, they changed 5-7 in the world where people live well into their hundreds. And so I've always been fascinated to go and learn more. And the other thing that motivated me to go there is the way that they approach medicine in Loma Linda is what they call whole person care, or not kind of just looking at, someone as a bag of diseases. It's who are you as a person? What's your lifestyle? How are you living? And all those other factors that really determine our health. And that was a big priority for them. So that was something I was very interested in. So Blue Zone, Adventist Health Study, and the way that people were treated was the major motivations for me to do my training there. Mm-hmm.
Fantastic. And it's really interesting, actually, as we talk to Lifeforce members and we've got to know and our clinicians and our health coaches as well, there's often very personal reasons why people make the decision to take control of their health. And we'd love to hear more about that for folks who've joined us here today. We're actually going to be doing a gift for folks and offering a free Lifeforce diagnostic to one person who's with us today. And the prompt we'd like you to answer to be in the running for that is, what's your personal motivation for optimizing your health? What is it that's really drawing you into this conversation to want to be more proactive about your health and about your longevity? So pop that in the chat, and we'll be giving away one free Lifeforce diagnostic at the end of the session today, which is great. And then if you're just generally interested in learning more about Lifeforce and the membership and what you can do to get started, go to mylifeforce.com/start. mylifeforce.com/start. So let's dive in, Dr. Renae. So this conversation around personalized medicine is one of those things that sounds fantastic, but can often be misunderstood. So how do you actually explain what is personalized medicine? How do you spot personalized medicine and what makes effective personalized medicine?
Great question. And I think I've heard that term thrown around a lot with different answers, but I can share with you my personal answer. And what I think about with personalized medicine is we're moving from a model where we have kind of vague numbers based on the population that represent health. We have kind of treatment options that are, again, kind of generalized and specific. They're based on kind of bigger population levels. And they're really designed to stop people from being sick, or if they're sick, trying to get them better. There isn't a lot of focus on how do I feel my absolute best? Yes, cool, maybe my standard labs look normal, but I don't feel great. I used to feel much better, or I just think I could be doing better. And so what I see personalized medicine is diving a lot deeper and looking at someone way more as an individual, looking at their lifestyle. How are they eating? How are they sleeping? How are they managing stress? How's their physical activity? And then having a way deeper dive in biomarkers. We really want to see what's happening at a hormonal level, what's happening at a metabolic level, what are even just basic critical nutrients doing for you? And then using all of that information to design a very tailored approach for the individual. That program that we design is not going to work for someone else. It's specifically targeted to that person so that they can thrive in all aspects of their life.
Awesome. Yeah, and we see this as something that really starts to come top of mind for people roughly over the age of 30. And that's not coincidental, because we know that's a stage of life that's very rich but also very challenging. It's also a stage of life where physiologically there's things going on that you need to start paying attention to. So tell us a little bit about that, from a clinical perspective. What's actually happening inside your body over the age of 30, and what are these trends that do tend to impact quality of life and also the trajectory you're on?
I guess I'll start. I joke about this a lot with patients and our members, is that I feel like youth is wasted on the young, right? The time when you're the most energetic, you feel the best, everything's going well, you're not always doing it as much. And I feel like the rich part, like you say, about life is really that kind of, on average, let's say 30 to 65, traditionally speaking, right? We obviously are seeing people that are doing way longer, and that's the goal, to have that health span as long as possible. But let's say this is a big part of our life where things start to shift. And a lot of the time it's stress levels interfering with things like sleep, and a lot of competing priorities. Maybe we've got young kids, we've got a job that we're trying to succeed in, we're trying to balance that with friends and life. And so you're trying to do an awful lot. At the same time, and this was one of the saddest statistics I ever learned in medicine, our human body isn't designed to live that much longer than 35. We're designed to live richly through our reproductive years, raise our children old enough for them to reproduce, which, if we put, it's very different to what we do in our society, but reproductive age starts in our teens, early teens. So we're really designed to have children, for them to have children, and then for us to stop eating all the food and taking up all the resources. So the human body is not designed to live the extremely long health span and longevity that we're striving for today. So because of that, we start to see a lot of changes. I would say especially we start to see, for many people, depletion of critical nutrients. We see significant shifts in metabolic health. It becomes much harder to maintain metabolic health than it once was. And we do start to see shifts in hormones as early as late 20s and early 30s that only tend to progress as people get older and older.
Great. Yeah, I mean, I know for me personally, as a Lifeforce member, as well as someone who's involved in the company, that understanding that I'm not imagining it, that there are things that are changing that I can now measure and do something about, was a real weight off. It was very empowering to feel like I could do something about it, and not just have to sort of shrug shoulders and deal with some of the trends you're describing. As someone who was chasing a toddler around the house at 2 a.m. last night, I totally hear you on the sleep and the energy point. What do you see as the most common reasons why folks come to Lifeforce? When you become a Lifeforce member, if folks who haven't already joined up, we go pretty deep into how are you feeling, what are your goals, what do you want to achieve. But on that sort of goals front and the top reasons why people are deciding to become members, what do you see most commonly?
There's obviously a lot, and I would never discourage someone if they had a different priority that maybe we didn't mention. I would still encourage them to come and see us, obviously. But I definitely would have to say, of all the members I see at Lifeforce, I think energy probably tops it as the number one reason. People want to feel better and have more energy to be able to do more with their life and feel better on a day-to-day basis.
Got it. And so energy is interesting. So let's just stick with that for a second and dig into it. And I can see from the comments that there's a lot of folks who are already in the room who are focused on energy, which is no surprise. What's actually going on? Like, what's underneath this theme around I want more energy and I want more vitality? What are as a clinician, when a Lifeforce member comes to you and you're on a consult, what are the things you're really looking at closely to try and diagnose what could be driving?
Great question. I would say there's two major things I start with at Lifeforce. And the first one is your foundations or your pillars of health from either a functional medicine, lifestyle medicine perspective. They're very similar. How are you eating? how are you sleeping? How are you moving your body? How are you managing your stress? And what kind of substances or harmful exposures are you having in your life? That's number one, because that's the basics of health. The second part I'm going to do is a deep dive into your biomarkers, and we break them up very specifically at Lifeforce. We'll have your critical nutrients, we'll have your organ health, we'll have your metabolic health, your key risk factors, and then your hormonal health. And I typically go through them in that order, and they all link together. In medicine, we've become very, very siloed into, this is your eye doctor, and this is your throat doctor, and this is your heart doctor. But realistically, the human body functions as one, which is why we look at such a broad variety of biomarkers. And I love explaining to people how they interact. There's so many things like your hormones really do impact your blood sugar and your cholesterol levels, and all kinds of things all go together. So that's where I usually start. And most of the time, it would be very rare that we couldn't find one thing that was influencing why their energy was suboptimal. And as you mentioned before, and I love this term, it's so empowering. It's not that someone wants something to be wrong with them. No one goes to the doctor and wants a negative diagnosis. But when you can see something that's maybe a little bit off, that is directly contributing to the symptoms you're experiencing, it's very validating and it's very empowering to then have a direction to go to be able to mitigate those symptoms and start to feel better again.
Great. Mm-hmm. And on the lifestyle side, because I know this is an area where you are a very, very deep expert. From an energy perspective, what are the top one or two things that you would really recommend dialing in for the folks listening if they're dealing with fluctuations in energy that are not helping them live the way they want to live? What do you think are the biggest levers from a lifestyle perspective to help with that?
So when we're looking at lifestyle and energy, I really think that sleep has to be a really, really solid focus. If you don't have your sleep, it's really hard to have good energy the next day. So very commonly, I will start out with looking at sleep quality, sleep quantity, deep sleep, mouth breathing, snoring, room environment. Lots of things can contribute to sleep. So that's number one. The second one that stands out to me is nutrition. Nutrition cannot be underrated. Are you eating too much of, foods that are not helpful for you, and then you're tired and sluggish? Are you skipping meals all day and running off way too much caffeine? Are you getting in all the nutrients that you need? Are you getting in plenty of fruits and vegetables and fiber and all the things that we need to build those biomarkers to looking in good ranges that then lead on to energy? I mentioned things like substance use, and by substance use, I just mean things like how much alcohol are you actually drinking? It can be really, really easy trap to fall into. Drinking at night, thinking you're getting a good night's sleep, really impairing your sleep and feeling worse the next day. Caffeine dependency is a big one. So looking at those lifestyle factors, they're probably the big ones that stand out. And then I usually follow up with energy. Now, exercise. Exercise and energy is a hard one. If you're exhausted, you probably don't want to exercise, but usually even if you just push yourself to do 5, 10, 15 minutes of even just walking outside, energy levels start to increase on average for a lot of people.
Great. And on the sleep topic, what's your sleep hack of choice? What's the one sleep hack that you think has been most valuable for you that folks watching this as they're going about their days today? What's the one sleep hack you'd love them to remember after this session?
I joke about it, and I've actually heard other people talk about this in different ways, but get out of your own way, I think, is a big one for sleep. Like most people know what they need to do for sleep, but we simply don't do it. We allow competing priorities. We allow that one last email, that last little work task, that extra TV show, a little bit of scrolling on the internet. We all know we shouldn't be doing it, but we all do it. So I heard on a podcast recently, someone called it firing their night self. And I love that term. Like, just get out of your own way, make yourself strict guidelines, like an absolute cutoff, an absolute bedtime, and really try and stick to it. That's what I would say would be my number one hack is, get out of your own way and do the things you should be doing.
Awesome. Yeah, I can definitely identify with that for sure. So folks who might have joined a little bit late, just a reminder that we are actually gifting a free Lifeforce diagnostic during the session. So this is the best way to understand your baseline and where you're starting from on this health optimization journey. So if you're interested in that, in the chat, let us know what is your motivation for wanting to take control of your health. So just a reminder to get those answers in. So Dr. Renae, sort of pivoting from the lifestyle topic into more of the other interventions that are important in this in this toolbox of how you take control of your health. Hormone balance is a very hot topic at the moment, and it's been really exciting to see the conversation about hormone balance moving more and more mainstream, and people starting to, be curious and aware that this is a big factor. I'd love to just unpack this a little bit, but really look at it more through a male and female lens, because I think there's some nuance there that's really important. Tell us a little bit about, starting with females to begin with. Talk us a little bit about what is the trajectory of hormone balance through this stage of life? What are the major things that are occurring hormonally that people need to pay attention to, and what you can do about it as well?
Absolutely. Female health is so fascinating. We could talk about the changes that females go through, and men, for hours and hours. But if I had to keep it really short, what I typically see in your average female that's coming to Lifeforce, this typically starts late 20s, early 30s, sometimes a little later for women, but we start to see a little bit of a decline in something called DHEA. And DHEA is your pro-hormone precursor, building blocks, if you will, to make the rest of your hormones. And typically it takes some time to feel the effects of this, but you can imagine if you're trying to build a house and you don't have enough bricks, you're really going to start to feel that impact. It's harder to do things. People find they're more tired. Their sleep may be a little bit off. Their energy levels are not so great. Body composition starts to change. Physical performance, mental performance, and brain fog, sex drive, libido, sexual function, motivation, and drive. And a lot of people just say, I just don't feel like myself anymore. And so DHEA is one of the first places that I'm typically look at, and that kind of starts the conversation. The other major part for females is obviously the menstrual cycle, and that's a lot of the regulation with estrogen and progesterone. So as a very basic 101, day one of your period is the first day of your follicular phase, and that's where your estrogen will start to increase, peaks around ovulation, and then your progesterone will start to increase, drop off, and then you have your menstrual period. And that goes on typically every 28 to 35 days for the average female. There's obviously individual variation. None of this is medical advice, but just kind of as a general overview. And what we start to see is with that decline in DHEA, we start to see declining in testosterone and then typically progesterone. So testosterone is a lot of those symptoms. And most women are shocked when I tell them they have testosterone, but a lot of women actually have even more testosterone than their other hormones. You have to change the units around a little bit, but most women are surprised that they, A, have testosterone, B, it does anything in their body. It's a very commonly associated hormone with men, but exquisitely important for women as well. That's usually the next one that starts to decline and starts to contribute to all those symptoms I just mentioned. The next one that typically declines is progesterone. And as progesterone starts to decline, it's a little more subtle. We often start to see shortening in the menstrual period. Menstrual periods are much more heavy, much more unpleasant. PMS, if it feels much more significant in your 30s and 40s, it is. It's not in your head. It becomes more and more significant. And you become more sensitive to the drop in progesterone or the changes in hormones that happen in that week to two before the periods are due. Then you start to see menstrual irregularities themselves. This is getting a little bit more 40s and 50s. The duration between can get shorter and shorter, symptoms can get more significant, and then that leads us into perimenopause, which is basically all of that on steroids and way more significant. You get things like night sweats, hot flashes, insomnia, anxiety, whole host of things, and that's really the time where I think the conversation starts for hormone replacement, hormone optimization, or supplementation. But it can start a lot earlier, and a lot of women I feel suffer for way too long, to the point where it's so extreme that they're struggling with their day-to-day function, and that's when they seek help. We love to step in a little bit earlier, looking at those ratios. What's your progesterone estradiol ratio early on, so that we can prevent a lot of those things from happening.
Great. Yeah, it's fascinating getting under the statistics around menopausal care in particular. Is a transition that 100% of women will experience, and yet 75% of females are unaware of any sort of support and don't receive any sort of specialist medical support in that transition, which is a massive change, not just for quality of life, but also for longevity, also for things around bone density and cardiovascular health and other drivers that will really determine how long you're likely to live as well. So again, very exciting to see this conversation start to move mainstream, and we're excited by the contribution we can make at Lifeforce in accelerating that. On the male hormone balance side, tell us a little bit about that. And there's this term that's emerged, andropause, is sort of trying to describe the changes that we see in male hormone balance over time. So just talk us a little bit about what is andropause and what are the effects that people might
Yeah, again,
experience because of it?
testosterone is probably your leading hormone that you hear about, but we have others. And I didn't even mention it for women, but growth hormone is another one we look at as well. And what happens with men is very similar from that perspective to women. They're starting to see declines in DHEA, so they don't have enough of that precursor, and then testosterone can start to decline as well. And a lot of men also, I feel like they delay care, much like women, because it's like, I don't know if there's something wrong with me. Is it in my head? Am I just imagining things? And it can take a lot of time and, I guess, courage to seek out to a doctor and say, hey, I'm really not feeling my best. Could we maybe take a look at my hormones? So andropause, it's not as abrupt as menopause. Women in menopause, if you catch their labs, and I've done this a few times at Lifeforce, between last period and then menopause, and hormones can fall off a cliff seemingly overnight. So it is a little bit more dramatic in women in my experience. But men, it often happens a lot earlier and probably more dramatic than we have typically thought. And it's where they see very similar declines in hormones. Their androgens in particular, DHEA, testosterone, and growth hormone all typically start to decline. And what do we see with that? The biggest things I hear people say, it's energy, it's sleep, often their mood. And sometimes you have to pry, are you having more road rage? Are you more short-tempered? Things that people don't usually come with, but when you mention it, they start to be like, oh yeah, I really am having that. The other part, body composition, is a big one. And I think that men notice it a lot. Just gaining muscle and strength becomes way harder than it ever had been. And it almost feels like you're just on this battle to maintain rather than actually starting to see progress like maybe you did when you were younger. I would say that men bring up sex drive and libido a lot more than women. It's common in both, but they probably bring it up and notice it a lot more, as well as sexual function itself is often related. So any kind of erectile dysfunction or just kind of not feeling as good as you once did can be really related to the hormone part as well. And just overall, I feel like motivation and drive, I hear a lot from men. They're like, they've been a really successful businessman, for example, or really good in their career, and they just can't be bothered and they don't know why, and it doesn't feel like them. And that's a lot of the things I see associated with so-called andropause, or that decline in hormones for men as well.
Great. And like anything in this space, the best first step is to just find out where you're starting from and get your hands on the data and information around what's going on in your body, including around hormone balance. And, when managed correctly, we know from our experience with Lifeforce members, and from your whole career as a physician in the space, that it can be transformational, but it also needs to be done the right way. And there is a thoughtfulness that has to occur around what does a good hormone optimization partner and health optimization partner generally look like. So, whether that's through Lifeforce or through other solutions, I'd love you just to share a bit, any sort of framework you have, or just how you think about how folks on this session can help identify what is an effective, safe, responsible partner to help them with hormone balance and how to spot something that should be.
I love the thought of, a lot of it with hormones is stop guessing. We need to measure. We need to know what your hormones are, and we need to measure them at the right time. For women in particular, right time of your cycle, we need to know what we're measuring, and then we need to measure it. So you really need to have a good baseline and understanding of what your hormones even are before you even think about delving into it. The amount of times I've had people say like, oh yeah, I just bought some over-the-counter progesterone cream. I'm like, oh, please don't do that. Let's actually look at your levels first. But they feel so frustrated that they have to do something and they're not finding that support. There was a big thing I remember learning in medical school where it was like, oh, the worst thing is the patient that Googles things. But I had the total opposite opinion. There's so much information out there now, podcasts, the internet, so many things that can be supportive, that I would say do some of your own research. It can be helpful to go to your medical provider, kind of knowing what you're asking for. Now, it's not essential. I see people that know nothing about hormones, and I'm happy to start from square one. But I think sometimes you can be more confident going into that conversation if you know a little bit yourself. And then knowing whether your provider is a good match. I know when people have a good care for their own health, when they ask me lots of questions. I love being challenged. If I can't answer your question, you've probably made my day, because I'm going to go and find it out. But really asking questions, why am I doing this? Or, how did you determine that dose? Or, okay, I'm seeing this number looks abnormal, but you're telling me it's okay. This one, a common one for that, testosterone replacement drops FSH and LH, right? But that would see it as 0. why all of a sudden is this happening? And then working with a provider that can explain those things and kind of just go into detail what's happening in your body, what symptoms that could be correlated with, what we're suggesting, how that can then improve those symptoms, and how that looks over time. Because it's never, and I say to people, you know, medicine is a lot of the time very highly educated guesswork. I have to give you a program hormonally that I have a strong understanding and thought that it will work for you, but we need to monitor that. How does that change over time? How are you feeling with this dose? Did this feel better? Do we maybe need to add in something else? Do we need to take something away? And it's very much having that relationship with your physician that you trust them and they trust you to give that feedback of how you're feeling, and we just keep on moving together until you're like, hey, I really feel good. And that's always the goal.
Yeah. Right. So to play that back, I'm sort of hearing access to the right data. So someone who's really using data to inform the program. Clearly they need the right expertise in this field, but then rapport and chemistry and trust and sort of openness in the relationship is super important both ways to have these conversations. And then the ability to continue to refine and iterate to get in the right spot over time. It's, you know, this is not a one and done. Everyone's body's dynamic and it continues to change. So continuous improvement is sort of the right orientation.
To change over time. You know, the hormone replacement that was perfect for you when you were 51 is probably not going to be the same one when you're 55 or 60. And there's a reason we check every 3 months. You know, areas of stress can impact your hormones. You know, times where maybe you're injured, or maybe you're doing a really hard physical challenge. Like, things fluctuate continually over time. And having someone that can look at your numbers, listen to your symptoms, and tweak your program so that you continue to feel your best is really, really key with hormone optimization. You know, it's unfortunate. Sometimes people come and they're like, oh yeah, my doctor just refills it. I saw them 12 months ago. And I'm horrified. I'm just like, how do we know at all what's happening with your numbers and how you're feeling? But, you know, everyone does it differently, and it's not to discredit other people, but I think that really having someone that's educated in the area and does a lot of hormone replacement is probably going to be your biggest bet for getting good advice.
Awesome. Great. So let's actually change tack now and talk about some questions that we got from Lifeforce members. So we asked you to send in what's top of mind for you. What do you want to get some free Dr. Renae advice around on the question? So two topics that are always very interesting to folks are inflammation and gut health. So on the inflammation side, tell us a little bit about, you know, what are the biggest drivers in your mind around the inflammation that you see with members, and again on the lifestyle side, you know, what are the top 1 or 2 areas or things that people should focus on in your experience if they're concerned around inflammation?
I would say number 1 is what we eat. It is so easy to get inflamed by eating highly processed, highly refined, you know, I'm going to call them food-like products. They're not food. We need to be eating whole foods. And it's not just the food itself, it's the way that your gut reacts. You know, we want to have a healthy gut microbiome. I'm just going to tie your 2 topics together, but it's really how your gut reacts to these foods. We need to have an abundance of healthy food, healthy microbiome diversity, and that is strongly tied to inflammation. The second one I see a lot, and this is a real challenge, and I always want to make sure I approach it in a sensitive manner, but extra body fat is pro-inflammatory. It releases pro-inflammatory cytokines, interleukin-6, tumor necrosis factor alpha, and it drives inflammation. The amount of people with a high CRP, just because they're struggling with their weight, is incredible. Obviously, we can target both inflammation and weight and lots of things going on, and there's plenty of healthy people with extra weight, but if I'm looking at the top 2, it's nutrition and gut health and getting to a healthy weight range.
Great. You mentioned actually HSCRP in there, which is a very sort of wonky technical sounding biomarker, but I think it's worth a shout out because it's one of the biomarkers that, you know, we do really focus on for sure. It's actually the way you measure systemic inflammation in the body. So, you know, folks listening to this who are concerned around inflammation and are seeing that show up symptomatically, there is a biomarker that we use to actually understand where you're at inflammation, and then we can drill into it and solve the problem from there. But you know, if there's one takeaway for everyone on the session, HSCRP is a biomarker you should understand, and you should find a way to test that regularly and bring
And
that
it's
into
so
the
crazy
optimal
with
range
high
for
sensitive
sure.
CRP because the range is so narrow. We say optimal is less than 1, but even if someone's at 1.5, they often don't feel their best. We get them under 1 and they feel better. You feel less inflamed, less puffy, less joint pain, more energy. It's really crazy how sensitive that marker actually is when you get it back into the optimal ranges.
Yeah, and also strongly correlated with risk of heart attack and stroke as well. So, you know, when we talk about longevity, longevity is a really interesting term at the moment. There's all of a sudden so many conversations around longevity, and you know, it's anything from can we live to 150 to you know, really where we focus more, which is practical longevity around let's make sure you don't die prematurely and you live a long and healthy life. And so HSCRP is a important piece of the puzzle for that. On the gut health side, I'm interested in your take on where are we at in terms of the research for diagnostics around gut health. So, you know, there are a lot of products in the market at the moment where folks have an opportunity to get some sort of diagnostic around their gut health. How do you feel around the research there, and you know, how far away are we from a place where the insights are very reliable in gut health?
Yeah, really good question. And gut health is definitely something that comes up in conversations at Lifeforce, especially with, like, going back to what we were just saying, if your high sensitive CRP is elevated. Another marker of inflammation we look at is homocysteine. Both of those are very intrinsically linked to inflammatory markers from gut health. So we often have insights. In terms of testing gut health, there's a couple of tests out there that I have used previously and I like, things like GI mapping. I know a lot of people are very interested in getting their microbiome sequenced and things going on. I've had very mixed results. I think there's a lot of things we can still do the old-fashioned way, you know, things like elimination diets, trying different food patterns, getting out the processed food. There's a remarkable amount of people that just get better if you stop eating processed food and drinking soda and things like that. Lots of things that are very simple that don't require expensive testing. But sometimes you get stuck and people are like, I just don't know what to do anymore. And that's where I think testing can be helpful. They need to be interpreted by someone that understands them. So whether it's food sensitivity testing, food allergy testing, gut microbiome mapping, even just standard medical tests, stool testing, they really need to be interpreted in the context of what they truly mean, what you should be doing about them, and what symptoms they can be contributing to. I think the evidence is still mixed. I think clinical practice doesn't always match the evidence as well. So usually I try and do everything we can from a lifestyle perspective and looking at the biomarkers that we have. Maybe I'll suggest occasionally some additional testing. We can run through that. And then for those that are really stuck, that's when I would probably look into the more extensive testing. And that's always something that I would discuss on a one-to-one basis on what would be most appropriate. Of course.
Great. Awesome. Thank you for that. So I know we're about to bump up against time. To put you on the spot a little bit to wrap up, this conversation can get very, you know, science focused and technical, and it's easy to miss the forest for the trees, which is the why. You know, like, why are we doing this? Why do we want to make this investment of time and money and resources in taking control of our health? So what is that for you? You know, when you imagine yourself in a couple of decades time, what does good living look like for you, and why have you decided to really make this your passion and your career?
Such a good question. Gosh, so many things, but I'll tell you one of the things that really motivates me, and it is a true why for me, is in my personal life, I've seen my father reverse what was end-stage cancer and live in good health. He's in completely good health, living his dream life. I also had grandparents that lived into their late 90s in great health. My grandfather was a professional tennis player until he was 96, traveling the world doing what he loved. That's what longevity and a really good health span looks like, and it's super appealing. Living your dreams, being with your family members as long as possible, having your dream career, traveling the world, whatever it is that's meaningful. These are things that are meaningful to me, but all of those things, that's what that looks like. And as a doctor, I've seen the complete opposite. I've seen poor health in even pediatrics, you know, early diabetes. I've seen people in their 20s and 30s that feel 100. And that just doesn't allow the quality of life that I want to live. So it's always really motivated me to be as healthy as possible and prevent anything happening so I can live the life like the people I've aspired and that I've seen in my life. That just is always super close to me.
Fantastic. Well, we're lucky to have you. Hopefully, folks on the session today got a lot of value out of this conversation. We do have a winner for our diagnostic gift. So Sandy3994, congratulations. You're the winner of a free Lifeforce diagnostic. So, you know, we'll be sending a phlebotomist out to your house to draw your blood. We'll be looking at all your biomarkers, and you'll have a great conversation with Dr. Renae or one of our other excellent physicians on the Lifeforce team. So congrats on that. And thank you everyone else for the time and the curiosity and, you know, really the orientation to take control of your quality of life through better health. If you'd like to learn more, mylifeforce.com/start. When you're ready to get started, we're ready to help you. Hope you have a great rest of your day. Thanks, folks.